Good afternoon, I am Michaela Miller with the Wednesday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us as we welcome contributions from movements, healthcare providers and our audience. We would like this program to have a two-way flow of information. The number of confirmed COVID-19 cases nationally now stands at 17,200 with 7,960 recoveries and 312 deaths. The Western Cape currently has 10,558 confirmed infections, 4,363 recoveries and 183 deaths. Police officers conducting crime prevention patrols in Philippi East have arrested a 21-year-old man for murder and attempted murder, among other crimes. The suspect was taken into custody wearing a uniform resembling that of the South African National Defence Force. According to the SA Police Service, he had been involved in a variety of crimes, including robberies, hijacking, murder and attempted murder. He will appear in the Wynberg Magistrates Court once he has been charged. The family of an Ocean View couple who died in the Falls Bay Hospital last week suspect they might have drunk home-brewed ginger beer. Police are waiting for the autopsy results of the 50-year-old Winnie and her husband, 54-year-old Malvin Afrikaner, to determine the cause of death. The sale of alcohol has been banned since late March in South Africa. The Daily Voice reported that a relative who asked not to be identified alleged the couple drank home-brewed ginger beer which had a high alcohol content. The couple's family declined to comment. The University of Cape Town plans to adopt a four-phased approach to allowing students to return to campus. Deputy Vice-Chancellor for Transformation and Student Affairs, Professor Loretta Ferris, said final year medical students, academically vulnerable students and those needing access to the campus labs to complete their 2020 studies would be the first to return. Ferris said UCT needed to ensure social distancing was practiced, which meant that not all the beds in residences would be used. Screening and personal protection equipment was required for staff and students too, and medical students would need to undergo a period of quarantine. Meanwhile, a University of the Western Cape staff member has died from COVID-19. Spokesperson Hassan Abada said IT specialist Muhammad Amin Sali, known as the Linux Guru, was working from home at the time of his death. Abada said only essential workers were currently allowed on campus and that the one previously reported case had recovered. Those in contact with the patient had been traced and tested negative for the virus. UWC said Sali was soft-spoken and caring and would be missed. Now it's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show on Cape Town TV. The Langa COVID-19 Local Command Centre and the Community Policing Forum have spent 2 days educating residents about the coronavirus in the hope of showing its spread. The centre's Anele Kasana said residents were operating as normal with little social distancing, hence the need for such a campaign. Chairperson of Langa Community Policing Forum, Zanele Himbazela, said the area had seen a surge of informal traders from other townships erecting their stalls in the area and that fines would be issued to those in public without masks. She said they were closing in on businesses that were risking residents' lives. A number of salons operating in the area were closed. Basic Education Minister Anzi Motshekga has confirmed schools would be ready to reopen on 1st of June for learners from grade 7 to grade 12. She said the Education Department would work closely with the Department of Health, Public Work, Transport as well as Water and Sanitation to ensure the safety of teachers, learners and employees.
Schools will reopen on the 1st of June. We will start with grade 7s and 12, but also we will also look at small schools and special schools differently. On the state of readiness. Yesterday, I met with the Council of Education MECs, ministers, and we considered the latest reports on the state of readiness for the reopening of schools. And CM did note the progress that has been made so far, and also what has been received in schools. We did note that senior management teams have received materials required. And I must emphasize this, Chair, that the materials, those 2 sanitizers, were sent for SMT, they're not for school. So people are saying 2 bottles of sanitizers for the entire schools. Those were sent for managers who were expected in schools, because we can't, with all this vandalism, we can't send our stock far in advance because it will not be very safe. But as a sector, based on the reports that we received with the MECs, we are confident that the opening of schools across the province will happen as outlined in the plans that we have developed. The reports that we received were showing that preparations have been taking place and good progress has been made. All indications are that the preconditions for the reopening of schools are going to be met. And the delivery of all the essentials is being done, not necessarily to schools, but to safe places like warehouses. And that's what we're monitoring to say, has this province received its masks? Where are they? And when are they going to go to schools? So there is monitoring at that level, and we have received reports from provinces that orders have been placed and deliveries are beginning to happen. So the items that, amongst others, that we have ordered, which are beginning to arrive in schools, are your essentials like your sanitizers, your masks, your water and sanitation. And of course, schools will be cleaned, and most are being cleaned currently. The CM agreed that provinces have to move at the same pace, and we have emphasized the need to pay special attention to the health and safety of all learners, teachers, and employees in the schools. Whilst working with the Department of Health, it has had to profile all its workers and issue guidelines to guide them on how to work or manage all these underlying challenges around health, which the Department of Health has guided on. So we are working with the Department of Public Service on this, in this aspect, and we also urge parents to work closely with the schools to ensure that learners with pre-existing illnesses are also assisted. Schools will work with parents to obtain the information, which once again needs to be treated with the utmost care. And the matter which is paramount, we appeal, is cooperation in this regard. The other matter we had to address was around the provision of water. Again, we have profiled all the schools with the shortages of water or with very challenging supply of water. So we have entered into an implementation protocol with the Department of Water and Sanitation, and we are working together to ensure that no school goes without water. We will have what we call just-in-time delivery, so that even if we had not delivered today, but by the time we get to the school, with the countdown from next week, we will be able to say how many tanks and tankers have been deployed to schools.
Meanwhile, the National Association of School Governing Bodies, Matankanye, said its members were not happy about the progress made by the department since their last meeting.
We welcome the briefing by the minister yesterday. However, we were really not happy about the progress that was made, in the sense that now look, on the 11th, we met the minister just to get the progress, because on the 26th of April, we met and tabled our non-negotiables together. For schools to open, this must have been addressed. And if you remember, on the 11th, We met him, and then he told us that now only 2 provinces are ready, that is Western Cape and Gauteng. The rest of the provinces are not ready. But we were surprised yesterday. She could not tell us how many provinces have come on board, and then what is it that they have done, what is it that they have not yet done. And because now when she was talking there, it indicated very clear that now the PPEs really are not yet in schools. They are still somewhere in the households, and they don't want to take them to school because they are afraid of the vandalism that is occurring in schools. They are afraid that the PPEs might be stolen from schools. But we are just saying, if they are not sure of the safety of schools, then how safe are our children when they go back to schools, you know? So, and these are some of the things. But now, again, it's a question of the social distancing. And you know that now schools that belong to the working class, the rich, the poor of the poorest, the rural, the deep ruralist, are the schools which are hard hit. And we wanted to hear what are the progress that is made in those schools. Those schools really, they cannot accommodate the condition under which we must operate under this coronavirus. So we are not really happy about that. Also, and I must tell you that since we closed on the 18th up to date, some rich schools have been going to school because their children have we've been taught through online, and the poorest of the poor, there's been no way. But up to now, we don't know what arrangements are made because schools are going to be faced by classes, grade 7 and grade 12. Now, whilst grade 11 and grade 10 are at home, what is that they're doing? And also the question of parents whose children have underlying conditions. Then we have been told that now they can apply for homeschooling. How long will it take if then, because now the regulation indicates that now it's a process, but now we don't hear the minister saying, because we are operating under these very stringent conditions, then if a parent applies for the homeschooling, it will only take a week or it will take 3 days, then from there it will be approved. So we don't hear such things. So we are really not happy about this. Yes, the HR issues, look, we know that the schools that I've already mentioned, the poorest of the poor, the township, the rural, the deep rural, are overcrowded. And if they are overcrowded, we do not hear what the minister will do in terms of a class that is composed of 60 learners. And that class, when you divide it, it must be a class that is going to be, you are going to have 3 classes out of the class that is made up of 60 children. It's going to be 3 classes if they are saying at least to observe social distancing. Then we can have 20 children in a class. So a class that has 60, then you are going to have classes. But we do not hear what the minister says in terms of hiring the teachers, because that class of 60, then it needs 3 classes. I mean, these two more teachers. So one class, then it will go to 3 teachers. So we did not hear how are they going to do that, and as well as now the role that is going to be played by the school governing bodies, because some of these HR issues, then school governing bodies also involved in that. By this time, she's supposed to have told us the plan to say the 1,577 schools that have been damaged, the school governing bodies have already, or the provinces or the district have already started with work. This is what is going on in this, but we never had that. We just had the mention of 1,577 schools. So this is a problem again.
Western Cape Premier Alan Winde said schools in the province were preparing for learners' return and that everyone needed to come to the table to prevent children from being carriers of the virus.
Our education department have already identified which of those school teachers are at risk, and they will not be able to come back to school right away. They're going to have to prepare lessons at home, and they're going to have to get someone else to deliver those lessons, etc. The same thing with the learners. If a learner already has a comorbidity, well, quite frankly, that learner must not come back to school. That learner must get their lessons, and we must find another way of enabling that learner to continue. And the education department itself is busy developing new best practice, working out how we develop a new normal to slow the spread. What is it that we must do to, especially where we've got big classes, how do we divide those classes up so we can keep social distancing? But also the science tells us that our younger population are, first of all, less susceptible to the virus and also less able to spread the virus. But again, there's a responsibility has got to come into the system. So if you have granny that lives with you at home and is elderly and has comorbidities, or someone in your family has comorbidities, then as a responsible scholar, you or learner, you go to school weighing up those risks, and then when you come home, there'll be different protocols when you come home. You've got to, and I say that you should have a bowl in your kitchen or a bowl somewhere when you come. Maybe it's at the front door, a bucket or a bowl that's got water and jik in it, and you pop your mask directly into that bowl with jik as you come in. You make sure that you wash your hands immediately when you come in. In actual fact, if you've been at school the whole day or you've been out in a public space and you've traveled in a taxi, make sure that you actually change your clothing, put them into the wash when you get home before you even go and greet anybody at home. We've got to start making that the new normal. That's how we operate. And then I think the responsibility, whether it's at the school level or at the business level, any of these spaces that we open up, there's got to be responsibility there too. And the responsibility works both ways. It's got to come from the school, it's got to come from the department, it's got to come from the business, but it's also got to come from the user. So the learner, the commuter, or the customer.
With the ever increasing number of COVID-19 infections in the Western Cape, those working in essential services are among the most prone to contracting the disease. A number of police stations have had to close for decontamination, and police officers have been infected with coronavirus. Helga Jansen-Dauber spoke to the national spokesperson of the Police and Prison Civil Rights Union, Richard Mamabola, about the issue.
Good morning. I'm with Mr. Richard Mabula, who is the national spokesperson for the Police and Prisons Civil Rights Union. Good morning, Mr. Mabula. Thank you so much for joining us. We were just saying now you are in level 3, almost level 3 land in Gauteng.
Yes, indeed, that is the indication that has been put forth. However, I think just like in the Western Cape, there is a lot of concern about how level 3 will be treated. I think we've been seeing a lot of increasing numbers of infections in the province as well, though it might be lower than that in the Western Cape. So I think it's something that would obviously need to be assessed. By the way, with Gauteng is one special province wherein you get most people from different other provinces and of course across the continent who come here for employment purposes. Now, when the economy starts being very active, we will be seeing a lot of people, and that could obviously be a risk in increasing the levels of infections in the province. So I think government would obviously do wise to assess the situation as time goes on.
Absolutely, Mr. Mbula. Going to the infection rate in the prisons, which of course your members are working in those prisons. So to date, we have, this is in the last 24-hour cycle, 654 infections in the prisons across the country, 199 officials, 455 inmates, with the epicenter being in the Eastern Cape. 460 infections recorded in the Eastern Cape, 170 in the Western Cape. I must just say there have been recoveries. The question is, Mr. Mbula, what is the cause of the rapid infection rate in the prisons? You know.
Look, I think that the one thing we should note has been that though there had been challenges around the provision of PPEs, we feel that currently government has actually ensured that there are enough supplies. I mean, we sit in the National Steering Committee of both the DCS and the SAPS. So that issue has been obviously addressed to this extent. We are satisfied that there are sufficient deliveries. However, besides the fact that PPEs are available, we have been seeing increases, as you correctly say, especially Eastern Cape and the Western Cape. Part of the challenge we feel that is actually beyond just having PPEs available. Where the spaces within which our members operate, SAPS offices and DCS, of course, do not provide for social distancing. I mean, one of the reasons has been, I think, in the Western Cape specifically, immediately when somebody is infected, the likelihood is that they infect people who work within the same shift. And most of our police officers and correctional officials stay in what you call barracks. Those are closely confined areas. Whereas in case there's a person who is infected, the likelihood is that that infection will spread to the rest of the population. That is why we think there has been such a rise. But again, so we think that there should be measures to ensure that on a regular basis, in fact, if possible, on a daily basis, there should be screening processes, there should be sanitization processes, and the decontamination processes must continue. However, we also think that people who break lockdown rules should not be arrested, should not be taken to police holding cells because they are overcrowded as we speak. Instead, they should pay admission of guilt fines instead of being taken to stations, because that is where you then risk, with the higher number of people who are being incarcerated, you then risk most of them getting the disease. Within correctional centers as well, we think the fact that government has will be releasing about 19,000 inmates. Those are low risk inmates, of course, does not necessarily deal with the challenge of overcrowding, because I think our prisons across the country are meant to host 110,000 inmates, yet we've got a prison population of 165,000. So those are long-term, these are challenges which can only be resolved in the long term. However, in the short term, we think that these measures of ensuring that on a regular basis there are screening processes could be obviously dealt with. We do appreciate the fact that these are frontline workers. So besides having these PPEs available, there should be further measures taken.
Thank you so much for that detailed explanation, Mr. Mbula. The one point that I think deserves a little bit more of interrogation is the recommendation from POPCRU that people who break lockdown are not taken into holding cells, but are rather on the spot given an admission of guilt fine. What is the position, what is the legality of that in terms of if people want to perhaps challenge the arrest? Yeah.
Look, I think government can obviously look into better ways of ensuring. I think we're in a special condition currently as a country, and of course the fact that government could release, do release people with who have obviously been seen as low risk inmates, provision that going into jail, those fines would obviously, we think, would work better, but also ensure that you limit the number of infections. So under these conditions, we believe that government could obviously tilt some of the regulations that they obviously work by. So that I feel would obviously is the burden on the officials, correctional officials, of course, and even prisons, because police holding cells, because you look at all what has been happening, it's mainly because of that, where people are brought into holding cells whilst they had committed light crimes, whereas you could obviously have them staying at home and, of course, paying those fines.
I just wanted to check with you. So that, of course, is an indication of the criminal justice system, where people are held in prison conditions while awaiting bail. And am I correct in assuming that the low risk prisoners that you're talking about, they would fall in that? And it just shows that we've not been able to process people fast to get through the system. And so now we have this big population of low-risk criminals.
Yeah, there should be a way of dealing with that. I mean, you look at, for example, pause more present. Even before the COVID-19, we had challenges where you had people who were awaiting trial. Awaiting trial is having constituted a large number of the population. And of course, there were, of course, different researches that were done, and you could find that there were certain diseases that would develop from that condition. So it's a matter of ensuring that our processes, judicial processes, are effected in a faster manner so that people do not have to overstay within centers because they had not yet had their days in court. So that is part of the ongoing problem. But now that we've got COVID-19, it's an extraordinary problem that needs to be dealt with. So the judiciary can have a process where people are released and, of course, come back only maybe to answer to their cases on given days. So the bail process as well can be worked out in ensuring that people do not stay within confinements, but rather stay at home, and then when they have to come and account, they will do so. So it's something that is definitely doable.
Willie, thank you so much for your time. I wish you, your colleagues, and your families all the best in the period ahead, as you correctly say, extraordinary times.
Thank you, and we urge people of Western Cape to work together, ensuring that we do get over this bad chapter that is currently facing the province.
Coming up after the ad break, Stephanie Pitt will update you on what's trending on Twitter and a developing story.
Welcome back. You're still watching the Our City COVID-19 show. I'm Stephanie Pitt. Since the country went into lockdown, not everyone has obeyed the regulations, with a number of people continuing to jog. The Khayelitsha Community Policing Forum has had to call out some residents in the township who gathered at Lookout Hill to not congregate in one area. And now for social media. Share your thoughts with us on Facebook via Our City CT and on Twitter at Our City CT. These are the popular hashtags on Twitter today. Hashtag Bianca Scumbi. The Miss South African hopeful has been exposed for tweeting racist and offensive comments as back to 2013. Scumbi has subsequently apologized, and Twitter remains unapologetic, saying she should be called Miss Racist. Hashtag Miss SA. Miss South Africa CEO Stephanie Whale said the organization's rules state that any semi-finalist or finalist may not have been involved in any unsavory or unethical incidents. A decision has not yet been made on Scumbi, as entries are open until the 31st of May. After the ad break, Michaela Miller will be sharing information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Michaela Miller and the Our City News crew, have a good week. Goodbye.